When I came to CORA and really understood what Yes to Access was, it is that patient who hasn't been able to get healthcare because nobody takes their insurance. It's that mom who calls you crying because you say, I can see your kid tomorrow, and she has been trying for 3 months to get her kid in. This Yes to Access, access to care is what we stand for. It's just not on a superficial level with our company. We go to Capitol Hill, we rally, we sign petitions, we talk to our senators, we do all the things to not only help CORA, but really to cement our legacy and to help protect our industry.
We make sure that all patients have access in some fashion. Whether it's, we don't take their insurance, we offer self-pay. And we don't judge based on if you have the ability to have a certain insurance because you get reimbursed better. We want to make sure that you as a patient have access to any healthcare, exercises, stretches, remote therapeutic monitoring. We have the ability to make sure that we're connecting with all patients in any fashion. So why, as a PT, come to CORA? Why not? The opportunities that you have, the patients you get to serve, the teamwork, why not come to CORA and be a PT? Because the sky is the limit on what you can make.
Yes to Access means not turning away a patient, not turning away a patient for the insurance reasons. We treat the entire community, and it's important that we don't turn a patient away because their insurance is maybe not as reimbursing. What's important to us is that we get everybody in the door that needs the physical therapy. When a patient's called us, and they're so thankful that we can take them because they called 2 or 3 other places and they were told they couldn't go there for therapy because of their insurance. And so saying yes to access, it means giving everybody the opportunity to get at least some therapy.
At CORA, we support everyone, we serve everyone, even patients, no matter what kind of insurance, we see everybody. Other places, we may not be able to see them, but even for us, we're able to get them independent and moving and better serving the community.
And the way we see access is that one of our pillars is serving all. We live that every day because we accept over 4,000 insurances. If someone's like, do you take my insurance? I know we take your insurance. We are so proactive to make sure a service that a patient needs, we have access somewhere for them. Another thing is that we really focus on our employees, but they have the ability to specialize in almost anything they want. So if you work at a clinic that has a lot of neuro and that's something you're interested in, we give you so many tools as a physical therapist or a PTA to get those clinical skills.
Well, even our model, serve everyone, that's kind of probably the biggest reason I've stayed with CORA, is because hearing someone that has Medicaid or a Medicare replacement plan that no one else wants to take, and they're driving an hour and a half to see me because they're in the middle of nowhere, or they have to wait 4 weeks to go to the hospital, setting PT, and they're so appreciative and we're willing to help them get them in quickly. And to me, it's like everyone's on the same playing field when they come to CORA. I mean, it makes me feel better that I can help everyone too. And I think a lot of the people that come into work for us see that too and see the why we do things.